Hello, I'm Timothy Baird, Managing Editor of the American Journal of Medicine, and I'm here today with Dr. Joseph Alpert, our Editor-in-chief, and we'll be talking about an article that involves the epidemiology of sudden death in young athletes. Dr. Alpert, what can you tell us about this article?
Yes, of course, sudden death in young athletes is just a devastating event. I mean, the families, the doctors, everybody, the whole community is just devastated by these things. These are supposedly the healthiest people around, and all of a sudden one of them drops dead. It turns out that many of them have genetic abnormalities. Some of them have the Marfan syndrome, some have hypertrophic cardiomyopathy, and of course it's undiagnosed before the sudden death event. These days, most of these competitive games, of course, there's a defibrillator right at the court, one of these automatic defibrillators, so if a fatal arrhythmia occurs, you can get the patient back. But you'd rather know about it beforehand, pick out the people who are at risk and see if there isn't some way to keep them from doing the most competitive forms of sports. The Europeans really very strongly recommend an electrocardiogram on all competitive athletes. The American groups that have talked about this don't recommend that. I think actually physicians should think seriously about it, particularly if there's been any history of an abnormal cardiovascular event in the family of the athlete. I think they deserve a more introspective look with an electrocardiogram and possibly even an echo to try and pick up the people who are at high risk for this.
Thank you very much, Dr. Alpert. And folks, thanks for listening. And please join us on our YouTube channel, Facebook page, Twitter, and blog.